Actually, the younger patient can also have the knee arthritis as well when the patient has the risk factors such as the high energy trauma or the rheumatoid arthritis. But mostly of the patient of the knee arthritis patient is the elderly people because of the aging process. When we get old, the knee also gets old as well. So in conclusion, the knee arthritis can happen in both old people and also the young people. No, the treatment it depends on the degree of the arthritis. When the patient have an early arthritis, we start with the medication and also physiotherapy. In some patients that have more arthritis, maybe we can start with the injection and also the medication. But at the end, when the patient have the severe arthritis or deformity, the surgery will be the good option for this group of the patient because the surgery can help to correct the deformity and get the patient back to normal life again. Yes, the several papers or the several evidence show that the VELYS system can help the patient get back to normal life sooner than the conventional technique because the VELYS system can help to the patient have a less soft tissue trauma during operation. It can put the implant in the perfect position. So at the end, the patient have a better recovery, better function of the knee than the conventional technique. Yes, in the short term, but no in the long run. There will be an additional cost of the VELYS system over the conventional technique, but if you think in the long run, the VELYS system can help the patient faster recovery, less pain, get back to work sooner, and reduce the length of the stay. And lastly, the VELYS system can reduce the cost of the revision that might happen in the future.